The state budget Governor Scott Walker announced on Tuesday would spend 1 of 6 state tax dollars on health care. Wisconsin's Medicaid program is on track to grow in cost 33% over a 4-year period. Yet Wisconsin hospitals struggle to maintain patient care amid this ever-changing fiscal climate. So it's a wonderful time to ask key legislators and key medical professionals to talk about some of these issues. I want to thank, on my left, State Senator Leah Vukmir. She represents the 5th District. She's chairman of the Senate Committee on Health and Human Services and a member of the legislature's Joint Finance Committee that will be voting on the budget within a few months. State Representative Joe Sanfelippo, represents the 15th District. He chairs the Assembly Health Care Committee. Deb Standridge is president of Wheaton Franciscan. Carolynn Glocka is president of Aurora Sinai Medical Center, and thank you very much for hosting this. And Eric Borderding is president of the Wisconsin Hospital Association. Joe and Leah, Senator and Representative, I don't have to tell you this, there's a lot of competition for state tax dollars. K-12, transportation, the UW issues. Can you talk about your approach as we enter a budget cycle on healthcare funding, please, Senator?
Absolutely. Well, obviously, this will be my first time on the Joint Finance Committee, so we'll have a little bit of a learning curve here, but I've always had a hands-on approach to the budget process and have always had an eye towards healthcare issues because of my background as a nurse. So, it's a process of prioritizing our needs and based on, what we have available to us. And it's no different than what a family does around their kitchen table in terms of budgeting. But I am sensitive, of course, to healthcare issues because I do believe that they have such a ripple effect across all other areas, policy areas in our state. And so I think it's really important, and I think our state has demonstrated a record and a commitment towards making sure that our hospitals and our medical facilities are receiving the funds that they need. I represent quite a few of those hospitals, and so I obviously will be focusing in on that and watching it very closely.
Thank you, Senator. Representative?
So Senator Vukmir said we have had a strong commitment to the health care needs of the citizens of our state. In the last 2 budgets, Governor Walker and the legislature have put in over $1.75 billion extra into DHS spending. And their cost to continue, though, just this year alone is another $700 million for this budget. So it is a very serious topic because they have such growth in need just to continue that it kind of puts pressure on the rest of the budget in areas around the state. And once again, I don't envy Senator Vukmir for being on Joint Finance because they have a very tough job now to look at all of the spending statewide, to take a look at where we're spending money and really just prioritize it. I think that we definitely are going to continue our commitment to health care in the state, which includes taking a look at the Medicaid reimbursements. Luckily, Governor Walker has included the DISH payments again going forward into this budget. But again, we're hearing from the hospitals and from the doctors that there still is significant pressure to raise those revenues up.
Eric, before we hear from Deb and Carolyn, can you give us the perspective as a statewide organization? Well, here's what we know. As Representative alluded to, the DISH program, disproportionate share hospitals, is recommended at 30 million GPR, which will result in 75 million more over the next 2 years. But the governor's budget unveiled Tuesday did not include any Medicaid reimbursement rate increases. So can you give us the statewide perspective, please?
Sure. Let me address the cost issue first. Medicaid in Wisconsin clearly is a significant part of the state budget, and Wisconsin has chosen a path on Medicaid, and the route we chose on coverage expansion costs a lot of money, and so I think you're seeing that reflected in the governor's state budget, the governor including essentially funding the cost to continue request, and also funding, including funding to reauthorize the disproportionate share hospital program. Without that reauthorization, our safety net hospitals and our high Medicaid hospitals across the state would actually be facing a $75 million reimbursement cut. So while technically there is not an increase yet in the state budget, what the governor's done is he's made a commitment to prevent a reimbursement cut, and we think that's important because we certainly can't lose ground in our efforts to achieve progress on the Medicaid reimbursement side. The other thing I'd say about cost is that Medicaid is a significant cost for the state, but it's also a significant cost for our state's businesses. And that's reflected in the fact that when hospitals are reimbursed at far less than what it costs them to provide care, they have to recoup those unpaid costs from everyone else. And that's affecting the price of health care in Wisconsin. And last year, that cost shift that resulted added up to about $960 million in unpaid Medicaid costs that had to be shifted to everyone else. And that's about the equivalent of another corporate income tax in Wisconsin. So there, you have to look at the cost of our Medicaid program, both in terms of the cost to the state, but also in terms of its cost to our employers, and in terms of its cost to our healthcare providers, particularly those safety net providers that are struggling to take care of high number of uninsured and Medicaid patients every day. And we have two of those examples, leaders of those types of hospitals with us today who can speak very well to those challenges.
Well, thank you. Thanks for your patience, Deb and Carolyn. Your facilities treat probably the most number of MA patients in the state. So now you know part of the equation. DSH is funded, but no reimbursement increases. So can you give us a feel for what those partial decisions mean for your facilities over the next year or two?
Absolutely. I think on a daily basis we are experiencing the increase of patients coming through our emergency department. And at Aurora Sinai, 80% of the patients coming through our emergency department are covered by Medicaid. Historically, those patients tried to manage themselves at home. And a good example is a diabetic patient who tried to manage themselves at home, developed somewhere along the line a wound on their leg. That then led to immobility, which then may have led to dehydration or an electrolyte imbalance. They now are covered by Medicaid, but don't have the resources, or they don't know where to go, so they come to our emergency department with that now exacerbated condition. So we not only are treating that diabetes and the complications, but we then have really an obligation to that patient to set them up for continued care from that point on.
Deb, please.
You know, Carolyn and I have a lot in common because our hospitals are only 4 miles apart. So when she says that 80% of her patients are Medicaid here at Aurora Sinai, we experience the same thing at St. Joseph, 4 miles away. We have common zip codes. And our hospitals are in the most impoverished areas of Milwaukee County. Last year alone, St. Joseph served over 151,000 Medicaid patients. The resulting impact, as Eric has said, there was a shortfall of $32 million for St. Joseph in costs that were delivered but not reimbursed. We're projecting this year, to serve over 160,000 patients, increase because of the enrollment of Badger Care Plus, of residents into Badger Care Plus. That is exactly what we're seeing in our emergency departments because many of these people were without primary care physicians. They come to our emergency departments, and St. Joseph is the single busiest hospital emergency department in the entire state of Wisconsin. Last year, 84,000 visits. This year, projected to go to 90,000. So I agree with Carolyn. It is incumbent on us to make sure that we are getting the people who come to our hospitals, giving them the right care in the right place, and that is getting them in touch with a medical home, that being a primary care physician.
A question for our two legislators who will be voting on the 2015-2017 budget. Yesterday, in response to questions from reporters, Governor Walker said any additional tax collections could go to easing the cuts on the UW system. Do you think that amounts to a first draw on any additional, or do you think are you willing to have a dialogue over whether it should go to ease the cuts to the UW or raise the Medicaid reimbursement rates that our medical professionals have talked about? Senator?
I think it's too early to tell exactly which direction that would go. You know, we haven't really poured into the entire budget, number one. Number two, we haven't heard from the people. So the process now, the governor has proposed his budget. It comes to the Joint Finance Committee. We're going to be traveling around the state having hearings, and I think a lot of that will depend on what we hear. So my note to all of you is, get your voice heard regarding that, because I think that that does have an impact on legislators during the Joint Finance Committee process.
Representative?
So I read just the other day that for the next 15 years, we're going to have 10,000 people a day nationwide retiring, baby boomers. We have a lot fewer younger people joining the workforce. So when you add that combined with the pressures on Medicaid at the state level, the pressures on Medicare now coming from the federal level, we're on a collision course here. So that's why I say it's time that we take a look, and we have to prioritize our spending to take care of the things that are really truly important to us and where our responsibilities lie. So when the questions come down to supporting programs such as turning manure into electricity or properly funding Medicaid, for me it's a no-brainer, but we have to take a look at, it's a matter of setting priorities. And I think that's kind of where the discussion is going to center around for this budget.
But you both know who's going to be calling on you in the next few weeks. It's going to be the groups that want more spending on K-12. It's going to be transportation groups saying maybe we shouldn't bond $1.3 billion. And it's going to be the UW. How do you, these are all critical priorities. How do you balance some of these in terms of the health care? They provide, their institutions provide more services to MA patients than any in the state. How do you balance over the next few months?
It's not an easy process, let me tell you, and I know that over the course of the next few months we are going to be hearing from all those people, and we will also be hearing from our colleagues who are in the legislature who are not on the Joint Finance Committee. So it's taking all that information that we hear from them, what is important to them. They are the voice for the people they represent in their part of the state. So it's a give and take process, and at this point it's way too early to tell which direction it'll go in. But again, it's the process that has been laid out. It's, I think, a fair process, and I'm kind of excited to be a part of it.
Eric, is your statewide organization, are you going to call on legislators like these and ask them to raise MA reimbursement rates, which a governor's budget doesn't do? But thank you very much that DSH is funded?
Yes.
Yes. And the points that you're going to make are what? When you call on the Senator Tiffany's and
Sure.
Senator Bewley and Senator Schilling?
I think, this is the 14th state budget I've been through. And I think it will be, first of all, good luck, Senator Vukmir.
Wait, 10 when you started?
No. But I guess, first of all, I think this is going to be one of the most difficult for the legislature to grapple with, because, and every budget is difficult. Some are harder than others. But I think this is going to be a tough one because there are a lot of competing priorities out there. When it comes to Medicaid, I think it's worth reminding folks that Wisconsin has crafted an approach to Medicaid eligibility that has already taken eligibility down to those people in poverty, people who are below 100% of the federal poverty level, individuals who are making between $0 and $11,700 a year. So, point being that I don't think we have a particularly bloated or generous Medicaid program when it comes to eligibility. Maybe that charge could have been leveled a few years ago, but Wisconsin has taken steps already to trim its Medicaid program in terms of eligibility. So I think it means that we've already done a lot to try and control the cost of Medicaid. I can tell you from the healthcare provider side, we're controlling our operating costs, and both Deb and Carol can speak to that. I mean, we're doing a very good job of delivering a much better product in a much more efficient way. So, in fact, I think compared to previous budgets in previous years, healthcare is being delivered more efficiently in the Medicaid program probably than ever before. What we still have to deal with is the cost and who's paying the ultimate cost. The state's making an investment, but we are asking our employers in the state to continue paying more for Medicaid as well due to that cost shifting. Healthcare is a cost of doing business in the state. It's a cost of locating or growing a business in the state. And when you add nearly $1 billion to the cost of healthcare because of that Medicaid cost shift, that makes it more expensive to be an employer in Wisconsin. And that's really why another reason we have to keep focusing on Medicaid, and particularly from a reimbursement perspective.
Well, but one stat that you've shared with me that I remember, does Wisconsin have the second lowest MA reimbursement rates in the nation, Eric?
Wisconsin has the second lowest as a percent of cost hospital Medicaid reimbursement rates in the country.
The question for Deb and Carolyn. I'm just intrigued. I'm reading here from the governor's budget in brief, and it shows that Medicaid will be going up over a 4-year period 33%. That's just a statewide number. But can you tell us about what the drivers are in your MA costs at your hospitals and facilities?
You have a great example I think you should give.
We actually care for the sickest of the sick. So we pool our resources and then we care plan on those patients to see who needs the best and the most care in order to manage those resources wisely. 40% of the patients coming to Aurora Sinai are at that poverty level. So we need to be smart, and we have to partner with those patients in order for them to contribute to them living well.
And I think what you see is for a lot of the patients who are currently now enrolled in Badger Care Plus, they did not have insurance before. They're coming to see us very often in a most catastrophic state, very ill. We've had several patients, and one that I remember in particular kept coming to the emergency department several times as we were trying to connect this patient to a primary care provider. The emergency department is there to treat that symptom at that time. And when we finally were successful of connecting this individual with a primary care provider on the St. Joseph campus, why was he coming to the emergency department all the time? After a complete evaluation, this gentleman had stage 4 prostate cancer. Medicaid, childless adult individual, needed major surgery, major radiation oncology follow-up in terms of that, a whole host of things. Had the individual been able to seek care in a preventive stage, it would have been far less costly for the hospital, but also better management of that person's health on the front end as well. So it is all about making sure that our people are getting that preventive care, having a primary care, and making sure that we're taking care of them on the front end, not when you are catastrophically ill.
Senator?
If I could add to that, Steve, you know, the mental health issues in our area are a big part,
Yes.
and I think a big cost driver. And I agree with you. You have to take care of the individuals when they're not in the emergency room, when they're having their exacerbations of their symptoms. And you know, 35 years ago, I worked in this emergency room here at this hospital. And you know, when Representative Sanfelippo and I joined on the reforms for mental health, I was shocked at the statistics to see just the large percentages of individuals who are being treated in ERs versus in intensive outpatient and in settings. And that's where they really need to be caught. And so I think that's one of the areas where we're hoping that with the reforms that we put through, with the creation of this new board, giving the experts the ability to create a program that's going to best meet the needs of the individuals in this area, I think that's going to have an effect. I'm hoping that it will, because it's just wrong for people to be receiving that care, not just mental health, but in general. You know, there's always been this talk about the Affordable Care Act, which hasn't turned out to be very affordable. That's another factor that's a burden on businesses and providers, adding to that tax. But you know, it never changed the problem of utilization. It never worked on the issue of cost, because individuals really aren't given any skin in the game. They really have no awareness of what it costs to go to an emergency room versus wait until 8 o'clock, 9 o'clock in the morning to see their primary care doctor. And you know, until those of us that supported more consumer-driven healthcare models believed that once individuals understood what the costs were involved, then they would be more involved and more proactive in seeking that medical care during the day versus coming into the ERs at 2, 3 in the morning when, as we all know, the cost is greatly increased.
Joe, you also worked on that mental health issue. Any additional thoughts on how that might affect the balancing here in terms of services?
Yes, so just in the Milwaukee area, the psychiatric emergency room in Milwaukee was the second busiest in the country. And that was true a few years ago when I was on the county board. And so when you look at our population, you could see that we had a real problem here. And as Senator Vukmir mentioned, once somebody gets to the point where they're in crisis and in the emergency room, I believe the system has already failed them. You need to have the preventive and maintenance of effort for their health ahead of time in the community before they get into the emergency room setting. And again, along with mental care, but also with your physical care as well. I mean, we have some fabulous emergency rooms here in our hospitals in Milwaukee. In fact, I was in one Thanksgiving night with a family member, but in the end, that's really not where you want to go. You want to make sure that you have the clinics and medical centers and the outpatient settings to be able to hold those costs down, because those are the ways we're going to stretch our already scarce dollars much farther if we're treating at the front end before it goes into crisis as opposed to the expensive emergency room care.
Deb and Carolyn, can I ask you this? If nothing major changes, there's no increase in MA reimbursement rates, DSH is funded for 2 years, you've heard about a potential cut to Medicare. What potential difficult choices might your facilities have to consider 2 and 3 and 4 years out?
I think initially we'll continue doing what we're doing. We would manage our resources wisely. We would look to the patients coming into us. 50% of the 2,600 deliveries that we make at Aurora Sinai, those women have also an underlying mental health issue. We have to get at those problems in order to guide them to have a healthy next pregnancy. So I think we always have to be one step ahead. We have to treat, as everyone's saying, treat what comes to us, but then look a little further, look a little deeper to solve some of those problems.
So take a longer view in terms of patient care. Excuse
me.
me.
And I agree with what Carolyn is saying. We're not going to turn our backs at all on our population and the communities that we serve. We're going to be there. And it's just exactly what the senator and representative said. We have to help make a paradigm shift with our communities in how our consumers, our community members are viewing health care, and help them make the transition from our emergency departments, catastrophic care, that immediate intervention, to a proper outside medical home, primary care physicians, outpatient treatment. I would also say, though, if we want to predict that there's no change on the horizon, I'm going to go glass half full. I'm going to say there's still hope, and I'm going to continue to engage with the senator and the representative and people in the legislature to please take another look every single year, take another look at what is happening in our communities with health care, and again, make the case to champion increases in Medicaid reimbursement. I'm not one to give up hope.
We both have amazing caregivers within our hospitals, and we encourage them, get out there, tell your story, because, our people need to represent us, and they represent us through those day-to-day stories.
Eric, one issue that's out there on the horizon is the U.S. Supreme Court challenge to the Affordable Care Act. Is that something that could overturn all of the parameters and practices that we've been discussing for the last half hour?
Yes, depending on how the decision turns out. I think that if you look at how Wisconsin has structured its sort of hybrid, unique approach to coverage expansion, while we rejected the federal dollars and the eligibility parameters that came with those dollars under the ACA, we instead expanded Medicaid eligibility for everyone below 100% of FPL. And we actually have more people on Medicaid today than we did prior to April 1st of last year when this new approach went into effect. But we are also in the state, part and parcel to that approach, has been moving about 70,000 people off of Medicaid who are above 100% of federal poverty level, and working with healthcare providers, the state of Wisconsin, all working together very intentionally to help those folks connect with coverage on our federal exchange, coverage that comes with a premium subsidy that allows those people to buy coverage on the exchange for $19 a month. That was an intended and important component of Wisconsin's hybrid approach to coverage expansion. If the court rules for the plaintiff, given that Wisconsin has a federal exchange, those subsidies that allow that $19 a month coverage for very low-income people are gone. So it's going to be, I think it's going to be a challenge for Wisconsin. It'll be a significant challenge for the 30-plus states that will find themselves in this situation. We would hope that there will be a expeditious set of options coming out of Washington, but I also don't think we can kind of wait around for that in Wisconsin. I think there are going to be some things that states will have on the table that they can do. And over the next few months, WHA, and we're going to be partnering with members of the legislature and others to try and identify what some of those Wisconsin options could be to prevent what really could be a pretty significant problem.
Specializing in health care, I know you've thought about that. What is a potential Wisconsin response to if the U.S. Supreme Court does rule that states without their own exchanges are not allowed to have subsidies? Have you given any consideration to some options, Senator?
Well, I've been following it very closely, and I actually believe that it's going to rule the other way. I feel that confident about it, but that doesn't mean we aren't thinking about it. I'm just going to wait at this point. I know we've been talking to our federal delegation as well. It's an important aspect of this. All of the discussions we've had here today, we've had the federal ACA kind of hanging over us. And it has had a ripple effect on programs like when you cut Medicare to pay for the Affordable Care Act. All of these things are entwined. And so it's a very complex issue. And so, our federal delegation, I know, I've spoken with members of our Republican delegation, and, they're looking at putting in place a plan should we need to, depending on how the court rules. But we as a state as well are starting to look at that.
Any additional thoughts on that subject, Representative?
I think that we're in this unfortunate situation because we have the federal government who passed a 2,000-page bill without reading it, right? And so they are now saying that their intention all along was to have these subsidies be paid for on the federal exchange. So I agree with Senator Vukmir. I expect that the ruling is going to go in that direction, and if it doesn't, I think the federal government will step up and get it to the way they want it.
Thank you. This has been very informative. Let's close it this way. I'm going to ask Eric, when you testify before Senator Vukmir's Joint Finance Committee, she's one of 16 members, what's the shorthand of what you're going to say on the health care funding issue?
I will talk about the ongoing challenge that Medicaid reimbursement presents not only to health care providers but also to employers in this state. And I will also try to educate policymakers joined by our members who tell a better story than I do about all the very positive and proactive actions they are taking to address the health care needs of this state, and that we are a partner with the state. We're not just coming hat in hand. We're targeting our requests, and we're working with the state to provide better care and in more appropriate settings.
And then Carolynn and Deb, you probably won't testify before Finance because Eric will on your behalf, but he says there's such power in specific stories. So if you were testifying before Joint Finance on this issue, what would you say? Carolynn, would you want to go first?
I would first thank people for listening. And then I would say please continue to listen to those stories, but also know that we will continue to work very hard, and we will continue to work with patients to help them live well.
And we recognize that the budget period is going to be a very, very difficult one. There's a lot of people at the table. There's a lot of hard decisions to make. But coming to the table to talk about what is going on in Milwaukee County with the increase in Medicaid, they need to hear that story. They need to hear that Carolynn and our hospitals that are so close together, the high rate of stroke, the high rate of heart disease, diabetes, blood pressure, et cetera, infant mortality, preterm labor, those are the things that our hospitals struggle with every single day in helping our patients recover and become well. and having them move from using the emergency departments as their front door to a better preventive care environment. That's our challenge. We're coming to the table. We're investing in that. We're investing our resources to do that. But we need help with that in terms of reimbursement because of the increasing shortfall of Medicaid reimbursement.
Let's consider the show part of your fact-finding going into the next budget. So my questions for you two legislators, what message are you going to take forward to your caucuses on this issue of healthcare financing and MA? You want, Senator?
Well, I'm going to say that we have to continue our commitment to the medical facilities around our state, and because they are, especially those that are dealing with the most vulnerable individuals. I've really had an incredible privilege of working in many of these fine institutions, and it's why I have, and I know the commitment of the people that work there, the administrators, the nurses, the doctors, everyone. And that's why I have fought so hard against the federal involvement in government, because I think that we can do the best things right here more locally and at the state level. And so I'm going to say it's imperative. You know, that is the role of government, is to make sure that there is a safety net for those individuals who are the most vulnerable. And so that is where, you know, my commitment will continue.
Joe, your message to your caucus?
Similar. It's all about priorities, as I mentioned before. So we're going to take a look at the population that utilizes these services and weigh their needs versus other interests and needs in the state. And in the end, the commitment that has been made so far, I think it's important that we continue that as well going forward into the future.
Well, I want to thank you 5 professionals for coming to talk about probably one of the most important issues, obviously, in Wisconsin. So thank you for letting Wisconsin Eye help tell the story.
Thank you.